Hello, I'm Vanessa Vasquez, and I'm going to be presenting my case study on a patient that I'm currently seeing. She's a 15-month-old female with a severe oral hypersensitivity and severe feeding aversion. She was born at 36 weeks gestation at 4 pounds 12 ounces. Her mother suffers from type 1 diabetes and high blood pressure and was taking medication for both of these conditions during the time of the pregnancy. The mother's pregnancy is also remarkable for placenta previa and Bell's palsy. She was diagnosed with hypoplastic right heart syndrome in utero when she was 5 months in utero and was born with pulmonary atresia, intraventricular septum, and coronary sinuses. My patient was hospitalized for 102 days in the NICU until she reached an adequate weight so that she'd be able to undergo cardiac surgery. And after the cardiac surgery, she suffered from cardiac arrest, which therefore she needed CPR, and the CPR did a lot of damage to the surgery. So a week after that, she had to undergo a second surgery to be able to repair the damage that was done from the CPR. She also has a diagnosis of gastroesophageal reflux. She was able to bottle feed when she was born, but about 2 weeks before she underwent surgery, she was fatiguing during her feedings, and therefore she was placed on an NG tube. And she eventually lost her non-nutritive and her nutritive sucking reflexes. 4 days after being discharged from the hospital, her mother brought her back to the hospital because she was coughing and choking on the NG tube. And at that time, she was placed then with a G tube. And right now, that is her primary source of nutrition. My patient has undergone a modified barium swallow, and it was negative for aspiration. However, due to the lack of experience that she's had with oral feedings and oral stimulation, she developed the severe oral hypersensitivity and the severe feeding aversion. Right now, we're seeing my patient 4 times a week for 30-minute sessions. We've been seeing her for about 2 months. She's still receiving her primary nutrition via the G tube and is fed every 4 hours for 1 hour, 5 times a day. She doesn't receive any solids or liquids for nutrition purposes by mouth. She's not really tolerating any kind of teething rings or long periods of oral stimulation. She does accept the clinician's gloved fingers in her mouth and her lips and her cheeks, but for short periods of time. And pretty much we're working on increasing her feeding skills to be able to accept and swallow small amounts of purees and eventually small amounts of solids so that eventually we could wean her off the G tube and have her primary source of nutrition be intake by mouth. She's accepting the spoon. We started off with having her just tolerate the finger, or the gloved finger, of course, or the Nook brush around her mouth, her lips, her tongue. And once we saw that she was accepting that pretty well, we began with just accepting an empty spoon. And once we saw that she was becoming consistent in her acceptance with the empty spoon, we started coating the spoon with water. And then eventually, after a couple of sessions, she was consistently accepting that. And right now, we are at the stage of accepting the spoon coated with purees. Some of the purees we use is applesauce, pureed banana, pureed carrots, cereal. Those are pretty much the ones that we've been using so far. She's accepting it. However, once it's in her mouth, it seems like she doesn't know what to do next. So we are working on her initiation of the swallow and just helping her understand the concept of a swallow. Her oral transit times are long, and she is holding, and she often expels the bolus via a tongue thrust reflex that she should have, gotten rid of already by about 6 to 9 months of age, and she's already 15 months, so she should not have her tongue thrust reflex. However, because of her history, her long medical history, she didn't have as much oral stimulation and experience with food by mouth. So right now some of the goals we're working on are her ability to tolerate stimulation to the cheeks, lips, gums, tongue, with a nook brush or the gloved finger. We're pretty much done using the empty spoon. We use the empty spoon now to help her initiate a swallow. But like I said, right now we're at the point where we're working on her accepting small coatings of the spoon and her being able to initiate a swallow once the food is in her mouth. To begin, you want to make sure that you establish a good rapport with the patient. So you want to make sure that we want to create a positive experience. The feeding should be pleasant. If the baby is agitated or crying or upset, it's not going to create a good experience for her, and she's going to relate eating with negative experiences. So you want to make sure that you have maybe some music playing or a cartoon playing. You want to take out some toys that the child sees exclusively only for feeding, so that they will relate seeing those toys only during feeding time. And we need to be very consistent with our techniques, with our cues, and we have to establish control over the session and make sure that we have control at all times. Have the child seated properly in some kind of a feeding chair that they sit in every single time they're going to eat. Again, consistency is the key. So you want to make sure that they're sitting in the same seat every time. So some kind of a high chair, a feeding chair would be great. And once you create the positive environment with the music and the toys and the little cartoons, then you want to also, again, make sure that the child has not been fed through the G-tube prior to the therapy, because if they come to therapy and they're already full, they're not going to want to eat. And also, if you're going to do any kind of stimulation, you might nauseate the child, and they might not reply well to that kind of stimulation after they've already eaten. So make sure that they haven't eaten. And we start off with stimulating a little bit the tongue, the lips, the gums with the nook brush, with the gloved finger. Once you see that they're comfortable, they're playing with the toys, you're giving them a lot of positive reinforcement, the child's in a good mood, then you start coating the spoon with the puree and presenting it to the child. The child at this point is opening her mouth once she sees the spoon, so we place the spoon in her mouth and we push down gently on the tongue as we pull out the spoon to help her a little bit initiate the swallow. Sometimes she does swallow, sometimes she doesn't. Sometimes the food stays in her mouth, and like I said, she's holding and she doesn't really know what to do with it. So a technique that we're using when that happens is putting an empty spoon again in her mouth to kind of again push down on the tongue and help her initiate the swallow. And that's pretty much what we're working on right now. It has to remain very consistent. Once she gets through this stage of understanding the concept of the swallow, then we could move on to adding different textures and experimenting a little bit more with the textures. But right now, the most important part is to get her to understand the concept of a swallow and to be able to initiate a swallow right away once she's presented with the bolus in her mouth. Thank you for listening and have a nice day.